Good evening. My name is Robert Rose, and I come to you tonight because of the appalling coverage by 60 Minutes and an interview they were doing with Mr. Mike Moore. Now, Mr. Moore, we do owe a debt of gratitude. He is the one responsible for suing the tobacco industry and exposing the lies and the false advertising that they were doing. And they were fined billions of dollars. At this point in time, we are at the lowest tobacco use in the history of the nation, a feat many thought was not possible. So, Mr. Moore, we do owe you a thank you. But the appalling coverage tonight by 60 Minutes and the lies that you, sir, were telling the American people is not only reckless reporting, but it's endangering the lives of millions. In Mr. Moore's opening statement, he stated there are 72,000 overdose deaths annually. Now, the CDC, Centers for Disease Control, reports there are 64,000 deaths annually from overdoses. If you read the small print of the CDC's report, you will see that the 64,000 number represents legal, illegal, and over-the-counter medications. So, if a person happened to take too much insulin for diabetes, that would be considered an overdose death, a legally prescribed medication. The illegal drugs that are counted in that number does not stop at illicit fentanyl and heroin, but also includes cocaine, meth, amphetamines, ecstasy. Whatever an addict can use to get high is included in that number. Also included in that number are the over-the-counter medications such as Tylenol, ibuprofen, Motrin, cough syrup. These drugs are also included. That is the only way that they are able to get such a high number of overdose deaths. This year, 2018, the CDC admitted that there's only approximately 17,500 deaths related to opioid use, and most of those are related to illegal fentanyl and heroin coming from China and Mexico. So, Mr. Moore, as an educated man, why didn't you do your research before spouting these lies? You go on to talk about ARCOS, the system that the DEA uses to track prescribed medications. And you say that this is conclusive proof that Purdue Pharmaceutical and other drug companies have been causing or creating this drug epidemic or this opioid drug crisis. Sir, that's not true. It's not true at all. The majority of pain patients such as myself, chronic pain disease and intractable pain disease, there are 111 million Americans suffering from one of the two. Of the 111 million, 25 million, such as myself, suffer from intractable pain disease. This is a medical condition, a disease, or an injury which currently has no medical cure. So for these 111 million Americans, pain medications are our lifeline. And by your propaganda, by your falsified information, you are targeting us and our ability to live a happy life. You are denying us our constitutional right. Now, ARCOS and the DEA wants to say, oh, this company provided 3 million pills. So what? You need to put it in context. When was those pills provided? Who were they provided to? For example, prior to October of 2016, I was prescribed 3 tablets a day for pain. Not immediate release, but long acting or extended release tablets, 3 a day. Many patients also, if they're lucky, would receive breakthrough pain medication. I would have loved to have had that because I led an active lifestyle for nearly 20 years taking pain medication. Now, if you take my 3 a day, that would be 1,095 pills a year. But they don't base their numbers on 1 year. They'll say 3 million in 5 years or 3 million in 10 years. So if you take my 3 a day in a 5-year time span, that is 5,475 pills for one individual. And remember, I did not receive breakthrough meds. If you take that same number and multiply it by 10, that means in 10 years I received 10,950 pain pills. So you need to be explicit in the numbers that you're using, and the DEA is not doing that. And you, sir, did not help one bit by repeating those numbers. I implore you to give me an opportunity on 60 Minutes to discuss with you the harms that you're doing. If you continue going after pharmaceutical companies such as Purdue that produce legal medications for individuals such as myself suffering from a disease that currently has no medical cure, you are in fact going to increase the number of deaths, of overdose deaths. How so? As I said, October 2016, the VA put me on a forced taper to 0. My last pain medication was from the VA was December 29th of 2016. For nearly 2 years, I went with 0 pain meds. And if I did not have God in my life, if I wasn't a Marine who respects the job that our military does and respects the job that law enforcement does, I would have gone to the street as many others have done. Having no experience buying drugs off the streets, who's to know if I purchase a Percocet made out of fentanyl, as happened to several individuals in the state of Florida and in the state of Tennessee, as reported by 60 Minutes when they did the story on Prince. The individual that was making drugs out of aspirin, mixing it with fentanyl, he killed 10 individuals in Tennessee in just a short period of time because they did not know the drug they was buying was laced with fentanyl. 60 Minutes did a expose on how easy it is to get the components to make fentanyl from China. Went to China to even try and find the distributor. It does not take much for them to create these pills and make them look like legally prescribed medications. Is that what you want to force people to do by pushing this falsified crisis? Sir, these policies are killing American people, killing veterans, the elderly, the disabled, cancer patients, minorities, the lower socioeconomic groups that cannot afford the health care that you enjoy, that cannot afford the privileges of being a politician in Washington that has no clue about medicine passing these laws. I promise you, sir, that we are uniting. At current time, we have a program called Operation Starburst. It will be a lawsuit filed in as many of the 33 states that have laws limiting or denying pain medication to over 111 million Americans that suffer from chronic pain disease. These policies are killing Americans, and they knew it would happen as far back as 2008 with the 109th Senate, or 109th Congress. At that time, Dr. Alex DeLuca told the Senate what would happen to patients if you undertreated or denied them pain medication. It would be a death sentence. He even predicted that the suicide rate in this population would increase to 2 times the national average. It has occurred within the veteran community, since they've been denying pain medication for a much longer time than primary care physicians out here on the civilian market. With the VA Mission Act of 2018, civilian doctors are soon going to have to employ the same type policy of denying legitimate pain medication to patients. It's already happening, and the American suicide rate is increasing. The CDC has reported this. Suicide rate in the American population has drastically increased since the CDC guidelines, since mass media has refused to report the truth and the harms being done by these policies. Over 50% of those suicides, the individual had no prior mental health issue. So what is the explanation? Unrelenting pain, suffering so unimaginable, the majority of people cannot handle it. I've had so many people tell me they wish they were dead. I've talked to so many people that have suicide plans. And it's all because of the propaganda you, Mr. Moore, 60 Minutes, and these other mass media outlets are pushing on the American people based on lies. The CDC refuses to take responsibility, but they do admit that denial of pain medication is causing a problem now. So, Mr. Moore, I invite you to sit down and have a discussion with me there on the 60-minute format. At least give this Marine a chance to fight for my life the same way that you're going after my life. Without pain medication for the injuries that I received while I was in the United States Marine, I have no life, and that's what you're taking away, Mr. Moore. So I encourage you, give me a call, 423-794-8241. Give me a call and give me a chance to sit down and speak with you on 60 Minutes or any other major outlet. Please, Mr. Moore, before you are responsible for more deaths. Thank you. Take care, and may God bless.